This is Dr. Devaji Rao, Senior Consultant Surgeon from Chennai, India. I'm going to talk to you about the intestinal gas through this presentation. Let's imagine two individuals presenting with chest pain, one a younger individual and the second an older individual. In all probabilities, the younger individual must be having a non-cardiac pain, whereas the older individual must be having a cardiac chest pain. But between these two, differentiation is fairly difficult, and age of the patient helps you in differentiating this. The experience and intuition of the clinician really matters to identify between the two. What are the causes of non-cardiac chest pain? The commonest cause is the gastroesophageal reflux disease, otherwise known as the GERD or the GERD, local muscle and bone problems, lung conditions or diseases, stomach problems, stress, anxiety, and depression. But surprisingly, gas is not mentioned as one of the causes of non-cardiac chest pain, but it is linked with gastroesophageal reflux disease. There is a question: is there a link between heartburn and gas? Yes, heartburn and gas can occur together, but are not always connected directly. Although one does not cause the other, they may make each other worse. Certain underlying conditions can potentially cause both heartburn and gas. In these cases, treating the underlying condition will help relieve both the gas and the heartburn. To make the understanding better, let me give you a small example. Take a small metal tube which has two openings on either end. The same tube has been bent with dilatations and bends and made into a curved tube like this in the middle picture. The top end shows a wider orifice, whereas the lower end shows a smaller orifice. But this is a rigid tube. The entire tube is made soft and compared to the intestinal tube, and the wider end is the mouth and the lower end is the anus. Gas in the gastrointestinal tract is otherwise called the intestinal gas. A common man expresses the intestinal gas in many terms, such as gas, fart or farting, passing wind, breaking wind, having gas, trumping, tooting, or passing gas. For a medical man, gas is called the flatus. Flatulence is the word used for the process of passing gas from the digestive system through the rectum. Burbulence is the word used for the discomfort caused by the flatulence, and the flatology is the study of flatulence. I am going to discuss this topic on intestinal gas under three headings. 1. Untrapped intestinal gas. 2. Trapped intestinal gas. And the third, the leaked intestinal gas. First of all, let us understand what is normal intestinal gas. What are the causes of intestinal gas? The causes of intestinal gas are 1. Exogenous, that is the swallowed air, and 2. Endogenous, that is the colonic bacterial production of gas. The composition of intestinal gas varies. The exogenous gas consists of oxygen, nitrogen, and little of carbon dioxide, whereas the endogenous gas consists of more of carbon dioxide, hydrogen, methane, and hydrogen sulfide. What happens to the swallowed air? We swallow about 2000 ml of air a day while eating and drinking. We burp out about half of that. Swallowed air remains in the stomach for a while. The rest passes through the digestive tract in small amounts at regular intervals. It moves rapidly through the small intestine, propelled by normal peristalsis. Once the gas enters the colon, its propulsion slows and stays for a long time. In the intestine, bacterial action on food produces about 300 ml of gas. This endogenous gas mixes with the exogenous gas, travels along the colon, and ultimately gets expelled through the anus. On an average, in the upper intestinal tract, about 500 to 800 ml of gas is present, whereas in the lower digestive tract, 150 to 300 ml is present, mostly in the large intestine, about 200 ml. The composition of gas in the stomach is almost equal to that in the atmosphere. Oxygen forms about 15 to 16%, carbon dioxide 5 to 9%, and the majority is formed by the nitrogen by 75 to 80%. The endogenous gas is produced from the fibers in the complex sugars from gas producing fruits and vegetables by the organisms called archaea, especially the Methanobrevibacterium smithii in the colon. What are the symptoms caused by the intestinal gas normally? Normal or excessive volume of air does not produce any discomfort in the normal individuals if the buildup is low. Abnormal intestinal gas dynamics cause symptoms like the distension of the intestine affects intestinal contractions and cause painful cramps. Amount of gas has no relationship to the symptoms produced. Gas transit is independent of the movement of the solid component and is more efficient than erect position. This diagram shows that the gas in the stomach is expelled as a burp or a belch or an eructation, whereas the gas in the colon is released through the anus. Endogenously produced gas gets generally trapped in the intestine. Why does a burp produce sound? As the air in the stomach travels up the esophagus, it hits up against the closed upper esophageal sphincter. The trapped gas builds up a lot of pressure, creates a vibratory noise during its escape through the mouth. Why does a burp produce smell? There are many reasons. Food with pungent smell like garlic, onion, and fish can produce pungent smell. Gastric stasis, prolonged digestion, delayed absorption, and oral cavity problems like bad oral hygiene and poor dentition. Now comes the expulsion of gas in the intestine. Gas is expelled at 5 to 375 ml of gas per day in about 8 to 20 times in a day. The volume of first episode in the morning is significantly larger than those during the day, probably because of the build-up in the night. What are the factors which influence the gas passage? 1. The amount of swallowed air. 2. Nature of dietary intake. 3. Motility of bowel. 4. Medications. And finally, the stress. It's normal to pass gas, though volume and frequency may vary. It's also normal for intestinal gas to have a feculent odor which may be intense. It's very well known that expulsion of gas produces sound and smell. Both sound and smell are the sources of embarrassment and annoyance or comedy. Why does expulsion of gas produce sound? 1. The tightness of the sphincter and the buttock muscles cause the sound. The second is the anal embouchure. The embouchure is similar to the oral embouchure depicted in the picture. The third is the velocity of air escape. And lastly, the strenuous acts like coughing and sneezing. Why does expelled gas produce smell? The smell is produced because of the composition of the gas. The gas consists of two components, the non-smelly component, which is about 99%, and a smelly component, which is about 1%. The non-smelly component consists of oxygen, nitrogen, carbon dioxide, and the hydrogen. Carbon dioxide and hydrogen are produced in the intestine. Of the smelly components, indole, scatol, and ammonia produce a mothball smell, whereas the sulfur-containing compounds, the hydrogen sulfide, methyl mercaptan, dimethyl sulfide, and dimethyl disulfide produce the foul smell. Now we come to the excessive intestinal gas, otherwise called the flatulence, and its causes. Excessive swallowing of air is a major cause of excessive flatulence, and it is called aerophagia, which occurs due to chewing gum, smoking, sucking on objects such as pen tops, drinking carbonated drinks, and eating too quickly. The flatulence producing foods also a reason for excessive flatulence. What are the symptoms of excessive gas? Unexplainable pain, bloating, abdominal distension, excessive flatus volume, and gas incontinence. The associated conditions with flatulence are GRD, acid peptic disease, gastroenteritis, eating disorders, constipation, lactose intolerance, irritable bowel syndrome, Crohn's disease, diabetes mellitus, ulcerative colitis, dumping syndrome, and autoimmune pancreatitis. The factors which increase flatulence are drugs like ibuprofen, laxatives, antifungals, antidiabetics like metformin, and statins. Infections in giardiasis also increase flatulence. How do we manage flatulence? The exogenous gas is reduced by making an effort to eat slowly, have loose dentures fitted, treat postnasal drip, increase physical activity, manage lactose load, and gradual increase in dietary fiber. And also to avoid talking while eating, eating when you are upset or in a hurry, using a straw to drink, drinking from a bottle, drinking carbonated beverages, chewing gum or sucking on candy, smoking tobacco, eating food with sorbitol and fructose, and sipping hot beverages. How do we manage the flatulence? By controlling the endogenous gas. 1. Avoid gas producing food. Avoid complex carbohydrate food. Avoid milk to treat lactose intolerance. Use home remedies and use over the counter products. This figure shows the home remedies, the natural products available in helping the burping. When to see a doctor for flatulence? Vomiting, diarrhea, constipation, unintentional weight loss, heartburn, blood in stool. What are the long term effects of flatulence? Generally nil, social discomfort, change in lifestyle, and mood disturbances. What is the medical management of flatulence? Activated charcoal is used commonly, which absorbs gas. Simethicone coalesces small particles of air to make big ones and pass. Prokinetics are useful to increase the motility of the intestine. Lubiprostone relieves constipation. Antibiotics may be required to handle infections, and probiotics to manage the gut flora. When you look at the Guinness World Records, the longest burp was produced by Michel Faugion of Italy for a period of 1 minute, 13 seconds, and 57 milliseconds at the 13th annual Hard Rock Beer Festival Rutto Sound competition in Reggiolo, Italy on 16 June 2009. And the loudest burp was produced by Paul the Burper King Hun, unleashed a burp of 109.9 decibels at Butlins in UK in 2009, which is louder than a large orchestra. The loudest fart was produced by Doug Shupak of 168 decibels, close to the noise level of the takeoff of a fighter jet, and also Alwyn Meshes recorded a level of 194 decibels on May 16, 1972 at Texas. Now we come to the second part of my lecture, trapped intestinal gas. When the gas gets trapped in the intestine, it produces abdominal distension. Up to 3500 ml of air can be trapped in the intestine, and this distension is associated with vomiting and obstipation. The commonest cause of the intestinal gas getting trapped in the intestine is due to intestinal obstruction. The causes of intestinal obstruction vary in different age groups. In the newborn, it can be meconium or the Hirschsprung's disease. In the infants, the helminths form the common cause. In adolescents, the bands, intersusception, Meckel's diverticulum, and obstructed or strangulated hernia are the causes. In the adults, postoperative adhesions, intersusception, volvulus, malignant growth, and obstructed or strangulated hernia are the causes. And in the elderly, malignant growth or the obstructed or strangulated hernia are the causes. Enteroliths, foreign bodies, and gallstones are rare causes of intestinal obstruction. In the elderly group, fecal impaction is one of the medical causes of intestinal obstruction. If you notice this slide, you will see that intersusception is common to infants, adolescents, adults, and the elderly, and also the obstructed or strangulated hernia is common in the adolescents, adults, and the elderly. These are all the common causes of intersusception. The first figure on the left shows an ilioileal obstruction or ilioileal intersusception. The second is also the ilioileal intersusception caused by a benign tumor like a lipoma. And the picture at the bottom is a colocolic intersusception caused by a malignant growth in an elderly. This picture shows the other obstructing pathologies which cause trapping of the intestinal gas. The top pictures show the postoperative adhesions. The pictures at the bottom, on the left it is internal hernia, and on the right side it is an obstructed external hernia. What is the treatment for the intestinal obstruction which is producing trapping of the intestinal gas? For the fecal impaction, digital evacuation and laxatives are the treatment. For a mechanical obstruction, emergency surgery is required. Now we come to a condition called paralytic ileus. Paralytic ileus is paralysis of intestinal muscles, whether it is partial or total. It happens due to complex and multifactorial factors involving the bowel inflammation, inhibitory neural reflexes, and neurohormonal peptides. It causes functional blockage of the intestine and the gas gets trapped. The signs of intestinal obstruction will be present, and the common causes of paralytic ileus are abdominal surgery, drugs, spinal injuries, and electrolyte disturbances. The paralytic ileus management consists of watchful waiting, supportive treatment, correction of dehydration, and electrolyte abnormalities. Now we come to the third part of my lecture, leaked intestinal gas. How does the gas leak out of the intestine? It occurs due to a perforation of a pathological part of the intestine, possibly an ulcer, and this leaked gas is accompanied with the intestinal contents. The moment it happens, the omentum comes with rescue and comes and seals the perforation. In the meantime, the septic contents of the intestine, along with the gas, gets accumulated below the diaphragm, forming a subphrenic collection. If you look at the pathophysiology of the gastrointestinal perforation, the moment perforation occurs, the gas gets leaked out. Along with that, the contents of the intestine also leak out and cause localized peritonitis in the area of perforation. Later, the perforated contents gets distributed in the peritoneum, causing generalized peritonitis, which may again spread into the blood, causing septicemia and ultimately death. Radiologically, the leaked intestinal gas is diagnosed as a gas shadow under the dome of the diaphragm. When peritonitis is caused, it causes a ground glass appearance as shown in the picture on the right. What are the causes of GI tract perforations? Commonly, trauma, which can be a penetrating trauma or a blunt trauma, endoscopy, and iatrogenic injuries. Inflammations form the second part. The stomach, benign ulcer, duodenal ulcer, jejunal ulcers, typhoid ulcer, tuberculous ulcer, Crohn's disease, acute appendicitis, and ulcerative colitis. Malignant ulcer of the GIT is one of the causes of GI tract perforations. Since perforation is the only cause of a gas to get leaked out of the intestine, the treatment would be surgical. It will be an emergency laparotomy with a closure of the perforation with intestinal resection or and a peritoneal toileting. Morbidity and mortality associated with perforated intestines is very high to the tune of about 70%, but it is unpredictable. Now we come to the intestinal gas in children. What are the causes of intestinal gas in small children? Immature intestines, pockets of excessive gas, bubbles in the feeding formula, poor breastfeeding technique, getting very upset and crying, eating certain vegetables, ingesting a particular protein, and lactose intolerance. In older children, there are different causes of intestinal gas. There are three main causes of abdominal gas in children. One, swallowing air due to crying, sucking thumb, roaming around during food intake, watching gadgets while eating, chewing gum, drinking excess carbonated drinks, and nasal allergies. 2. Eating gas producing foods. And lastly, diseases that interfere with sugar absorption. How do you treat gas in children? First thing is to educate the new mother about the proper breastfeeding techniques and getting the burps. Second is use home remedies for the gas. And lastly, identify the associated problems and administer drugs only when necessary. What are the causes of intestinal obstruction in children? The causes are intersusception, Meckel's diverticulum, hernia, Hirschsprung's disease, imperforated malrotation of the gut, annular pancreas, and bands and adhesions. And intersusception forms a major cause to the tune of about 70%. Does intestinal perforation occur in children? Yes, there are many causes, and acute appendicitis is the commonest cause, followed by Meckel's diverticulitis, worm infestation, typhoid fever, inflammatory bowel disease, and spontaneous perforation in infants. What is the treatment of trapped and leaked intestinal gas in children? It is always emergency surgery. What are the take-home messages about intestinal gas? 1. Untrapped intestinal gas is treated by self-care and simple Medicare. The trapped intestinal gas is treated by planned Medicare or surgical care, and the leaked intestinal gas always emergency surgical care. In conclusion, it should be realized that the intestinal gas, like the cooking gas, is innocuous or maybe not dangerous when it is in its own abode, the gastrointestinal tract. But when it leaks out, it is extremely dangerous. Thank you very much for a very patient listening.